Hello everyone, my name is Kaitlyn Schneider and today I want to talk to you guys about the impact of aerobic and anaerobic exercise on managing depression and anxiety. I would like to share some insights on the significant role exercise plays in managing anxiety and depression. This topic is particularly important to me because it affects not only me but my friends and family as well. Exercise has long been recognized for its ability to alleviate symptoms of depression and anxiety. This is primarily due to the release of endorphins and other biomechanical changes that occur during physical activity. Personally, I have found that regular exercise, especially going to the gym, helps manage my anxiety. I know others who benefit from similar routines, highlighting the broad impact of physical activity on mental health. Both anaerobic and aerobic exercises are effective in reducing symptoms of depression and anxiety. Aerobic exercises such as running or swimming stand out for their effectiveness. Aerobic exercises like weightlifting also help, but might not be as effective for some people. Moderate intensity exercise in particular has been found to provide the most significant antidepressant effects. Examples of moderate intensity exercises include brisk walking, cycling, at a moderate pace, swimming, dancing, and gardening. So just getting outside, or not even outside, but just getting up, moving your body has significant benefits to improving your mental health. Research suggests that moderate intensity training yields better mental health outcomes compared to very light or very high intensity activities. Additionally, long-term, consistent exercise has shown to provide sustained improvements in mental health over time. Not only does regular exercise help reduce the severity of symptoms, but it can also serve as a complementary or alternative treatment option for individuals seeking alternatives to traditional therapies like medication. High-intensity workouts such as running, HIIT, and competitive sports were better at reducing anxiety with a pooled effect of negative 0.38. That's the chart is right there. I'll circle back to that. But however, more people tended to quit high-intensity programs, so it is important to choose exercise plans that match individuals' preferences and abilities because you don't want someone to go into a really high exercise routine regimen and then they quit because they are tired or burnt out already. So it's very important. Low intensity exercises like gentle yoga, stretching, and slow walking are also beneficial, just not as beneficial because that high intensity is what really gets your heart rate up, but the moderate intensity is like a middle ground of high and low. The benefits of exercise on mental health are not just short-term. Studies have found that the positive effect on anxiety and depression can last for several months after completing an exercise program. For example, the combined effect for long-term follow-up was negative 0.30. Negative 0.30, indicating that regular exercise can have lasting impacts on mental health. This means that consistent exercise can help maintain reduced anxiety and depression levels over time, making it a valuable part of both treatment and preventative mental health care. The reviewed literature regarding this poster consistently supports the positive impact of physical exercise on mental health. Aerobic exercise, in particular, stands out for its effectiveness on reducing symptoms of depression and anxiety. The physiological and psychological mechanisms underlying these benefits include the release of endorphins, reduction of stress hormones, and increased self-efficiency. Increased self-esteem, in other words. However, the variability in study designs and exercise protocols highlights the need for more rigorous research to establish optimal exercise regimens. So there's plenty of research pointing towards aerobic and anaerobic exercise really does help boost anxiety and depression symptoms. However, there's not enough research to be 100%. But the research that we do have, there's a lot of it, and what's the word? I can't think of the word. It's very good. It's good that we have all the research that we have, but we still need more research to be 100% on if it's high, moderate, or low. One meta-analysis found that exercise had a moderate, statistically significant positive effect on reducing depressive symptoms in adolescents, especially in clinical populations with diagnosed depression. Another large-scale study involving over 1.2 million participants highlighted that regular exercise significantly reduces the mental health burden, including anxiety and depression, with the most substantial benefits observed for team sports and cycling, so football, volleyball, and then cycling, obviously. Systematic reviews and meta-analysis of randomized controlled trials further supports the efficiency for both aerobic and resistance training in reducing symptoms of depression and anxiety in adolescents. Aerobic exercise has been shown to be particularly beneficial for individuals experiencing anxiety, with higher intensity exercise proving especially effective. However, we did talk about the higher dropout rates with high intensity exercise regimens. Combining exercise with behavioral therapy has also been found to significantly improve depression symptoms, particularly in older individuals, although its impact on anxiety reduction remains less clear. Factors influencing physical exercise participation among patients with mood and anxiety disorders have been explored, revealing that younger age, male gender, higher socioeconomic status, and lower BMI are associated with higher participation rates. So they're more likely to participate in training regimens that may help their anxiety and depression. Regular physical exercise correlates with reduced depressive symptoms, less fatigue, better work productivity, improved sleep, reduced anxiety, and enhanced libido. The comparison of aerobic exercise and stretching in patients with depression showed that both interventions had significant antidepressant effects, with aerobic exercise also providing short-term cognitive benefits. So let's circle back to the graph. The graph compares the effects of high intensity and low intensity exercise on anxiety reduction. As you can see, high intensity exercise has a greater impact on reducing anxiety, with a pooled size effect of negative 0.38. So this basically means that the effect size is a measure used in research to show the strength of the relationship between two variables. So in this case, it shows how effective high intensity exercise is at reducing anxiety compared to low intensity exercise. A negative effect size like the negative 0.38 indicates a reduction in anxiety levels. So the larger the absolute value, the stronger the effect. So negative 0.38 means a moderate reduction in anxiety due to high intensity exercise. And the confidence interval is 95%, which gives us the CI, the confidence interval is CI, negative 0.68 to negative 0.8. This gives us a range in which we can be 95% confident that the true effect size lies. Since this range does not include 0, we can be confident that high intensity exercise has a real effect on reducing anxiety with the 95% chance of it happening. However, it is important to note again that high intensity exercise has higher dropout rates, which means that not everyone can stick with these more intense routines. This highlights the importance of choosing an exercise plan that fits your personal preferences and abilities to ensure long-term adherence and benefits. So even though there's a 95% chance that high intensity exercises are going to reduce your depression and anxiety, you have to make sure that it's worth it in the long run, and it's not going to make you feel worse over time because you keep doing high intensity for a couple weeks and then dropping out and then restarting it again. You have to find that middle ground, which is why the moderate intensity exercise was talked about as being the most effective, even though high intensity is 95% effective. The moderate is more effective because it has lower dropout rates. So overall, it reduces anxiety and depression symptoms more than high intensity. But high intensity is better than low intensity. So regular physical exercise correlates with reduced depression symptoms, less fatigue, better work productivity, improved sleep. The relationship between aerobic and anaerobic exercise, healthy eating, and mental health has been examined, showing that both types of exercise along with healthy eating led to better psychological well-being. Aerobic exercise was more effective in reducing anxiety and depression, while combining both exercises showed positive effects on social relationships as well. In conclusion, exercise, especially at moderate intensity levels, can play a vital role in managing depression and anxiety, enhancing both short-term mood and long-term emotional well-being. While the effects of exercise on anxiety and depression are generally positive, further research is needed to determine the optimal exercise protocols for specific mental health conditions. Overall, physical exercise is a viable and effective intervention for improving mental health and should be integrated into treatment plans for mood disorders. Thank you everybody for listening, and have a good day.